Welcome back. It is 7:45. You're watching BT Vancouver. Thanks for joining us this morning. Well, more than 200 scientists from around the world are now pressuring the WHO to take a closer look at its guidelines when it comes to the way COVID-19 is spread. In an open letter that was released earlier this week, it says research suggests the virus could be airborne. Joining us now to talk more about this is Dr. Srinivas Murthy, an infectious disease expert at UBC. Hi, good morning. Thanks for joining us once again.
Good morning, Mary.
So right now, the WHO says the virus is transmitted through respiratory droplets and contact. What is your response to this?
I think based on the data that we have currently, the vast majority of transmissions are through respiratory droplets and contact. Whether or not a virus such as COVID-19 is airborne is less relevant than determining that we understand the vast majority of transmission is via droplets. We know that it's not as airborne as, say, measles, and emerging evidence will continue to guide policy as it changes going forward.
So how do these new findings differ from what the WHO is currently saying right now?
Sure. It differs in that the new suggestion is that the virus aerosolizes, and so it can basically live in the air for a period of time. There's no necessary science to suggest that just yet, and we're still learning a lot more about the virus as days go on. And the WHO is currently reviewing all of the available evidence to say if that's true or not.
So based on these recent airborne findings, is there anything people should be doing differently to protect themselves?
Not necessarily. I think right now we're still recommending that wearing masks in closed spaces and minimizing physical contacts with others, especially in closed regions, is the recommendation. If the virus is partially airborne, that doesn't necessarily change things from a practical standpoint.
What about airplanes? What would your advice be there? I know there's been a lot of talk about that in the last 2 weeks.
Sure, of course. I think maintaining as distance as possible would be still the recommendation. Airplanes are unique because they have filter systems, and so they clean the air more regularly than other closed buildings. And so from a practical perspective, they may be more safe than buildings with poor ventilation systems. That being said, it is a medium to higher risk scenario, and so maintaining caution in general on airplanes is warranted.
All right, good to know. So you were on our show back in early April. You were discussing a clinical trial that you are currently working on with your team at UBC, trying to find the best treatment for people who are struggling with COVID-19. How is your trial going?
Going quite well. And so remember, it's a global trial in coordination with the World Health Organization, and there have been about 6,000 patients so far who have been included. Unfortunately, the first two drugs that we've tested have not been effective. One of them is hydroxychloroquine that Donald Trump has spoken widely about, and we know fairly definitively that that's not useful in hospitalized patients. The second is Kaletra, which is an anti-HIV drug, and we've also learned that that is also not effective in hospitalized patients. We're moving on to the next step, and hopefully we'll find something that works quickly.
Okay, so, and sorry, you might have said this, but you were cutting out a bit there. What drugs seem to be the most effective in treating COVID-19?
So right now, the most effective drug is a simple steroid drug that some scientists in the United Kingdom have proven that is effective in treating patients who are hospitalized and very sick with COVID-19. We're looking for more drugs, so in combination with steroids, that can be similarly effective, and so that we can reduce the overall mortality for patients who are hospitalized with COVID-19.
All right, and how long have you been working on this trial for, and how close are you to finding a solution?
So since January, we've been working on it, and we'll continue to look for solutions as the outbreak progresses and release those information as it becomes available. And so hopefully we'll have answers in the next few weeks, and we'll have continued answers as more drugs become available over the fall and winter.
Okay, very exciting. Dr. Srinivas Murthy, thank you so much for joining us this morning. It was great to have you.
Take care. Have a good morning.
All right, 7:50 now on Breakfast Television. We're going to take a break. Thor has your entertainment news coming up.